So as we examine the American healthcare system in 2024, we can't help but note the tragic irony of former United Health Group CEO's recent murder. And while his compensation package likely once symbolized everything wrong with the system, violence is never the answer, to be honest with you. But still, it's not hard to see his death as a dark metaphor for a system that has metaphorically killed the dreams and finances of countless Americans. So picture this. You're in a hospital waiting room, clutching your chest because of some mysterious pain. The only thing hurting you more than your chest is likely the anxiety of wondering how much this visit will cost. Welcome to the American healthcare system, where the bill is scarier than whatever brought you to the hospital in the first place. So as you flip through a magazine from 2019, because apparently hospitals can afford $500 aspirin, but not current reading material, you can't help but wonder how we got here. So here's a fun fact that's actually not fun at all. 66.5% of all bankruptcies in America are due to medical bills. And here's the kicker, 72% of these people had health insurance. It's like buying an umbrella, but still getting soaked because the umbrella company decided that rain wasn't covered in your precipitation protection plan. But wait, it gets better, or worse depending on your perspective. A recent study showed that 63% of Americans are one medical emergency away from selling their Pokemon card collection on eBay. And we're not talking about minor expenses here. The average hospital stay costs more than 3 months' salary for most Americans. It's really like playing Russian roulette with your finances, except all chambers are loaded with medical debt. So want to hear something even more mind-bending? Out of all the bankruptcies called by medical bills, most of these folks weren't uninsured hippies living off of the grid. They were responsible adults who thought they were doing the right thing by paying for health insurance. But plot twist, the insurance was about as useful as a chocolate teapot in a sauna. So you know how people like surprise parties? Well, healthcare has its own version of surprises, except nobody's jumping out yelling happy birthday. Instead, they're jumping out with a bill that makes you wish you had never been born. These are called surprise medical bills, and 41% of insured adults have gotten one. It's like ordering a $10 burger and getting a bill for $400 because the restaurant decided that lettuce was out of network, the tomato was experimental, and the chef who glanced at your plate while walking by was a specialist consultant. And here's another sobering statistic. 78% of adults have avoided hospital visits due to cost. That's right, people are sitting at home playing doctor with WebMD because they're afraid of the bill more than the disease itself. Is this chest pain a heart attack or anxiety about potential medical costs? A question that's becoming as American as apple pie, which, if consumed in a hospital, would probably be billed as specialized nutritional therapy at $847 per slice. So want to know how hospitals decide their prices? Imagine walking into a car dealership where the sales process goes something like this. How much is that car? I don't know. How much do you have? I have insurance. Oh, in that case, it's somewhere between $44,000 and $484,000. That's quite a range. Don't worry, we'll tell you the actual price after you buy it. Can I at least know what color it is? That'll be a $250 color consultation. And this isn't a joke. This is literally how hospital pricing works. When researchers called 101 hospitals asking for a price of the same heart bypass operation, only 53 even provided a price, and it ranged anywhere from $44,000 to $448,000. Same procedure, same country, 10 times the price difference. It's like playing The Price is Right, except you're blindfolded, the prizes are all medical procedures, and Drew Carey has been replaced by a hospital administrator who's really excited about their new yacht. Enter United Healthcare, America's largest insurer, who's perfected the art of making money disappear faster than a magician in Vegas. Their favorite trick is denying claims. It's like a reverse Santa Claus. Instead of giving gifts, they're professionally saying no to people who need medical care. Their corporate motto might as well be, we're not happy until you're not happy. So nearly 1 in 5 claims gets denied. That's 50 million instances of Americans being told, sorry, we know you pay us monthly for insurance, but have you considered just not being sick instead? You can appeal these denials, but only 1 in 500 people do, and even then, 59% of those appeals fail. It's like playing a game where the house always wins, except the house is wearing a lab coat and pretending to care about your health while checking their stock portfolio. The best part, insurance companies have turned denial into an art form. They employ armies of people whose sole job is finding creative ways to say no. It's like having a professional breakup artist on retainer, except instead of ending relationships, they're ending your hopes of getting that kidney stone removed without selling your firstborn child. But wait, there is more. United Healthcare isn't content with just being your insurer. They want to be your everything. They're buying up doctors' practices, pharmacies, and even loan providers. It's like if your local supermarket also owned the farm, the delivery trucks, and the bank that gave you a loan to buy groceries. Actually, it's worse. Imagine if that supermarket could also decide whether you're allowed to eat or not. They call it vertical integration, which sounds much nicer than healthcare monopoly. It's corporate speak for, we want to own every aspect of your medical care, from the tongue depressor in your doctor's office to the collection agency that'll be calling you about your unpaid bills. Soon they might own every step of your healthcare journey, from the Advil you buy online, to the doctor who prescribes it, to the loan you need to pay for it, to the insurance that partially covers it. maybe if they're feeling generous and Mercury isn't in retrograde. And let's not forget their latest innovation, combining healthcare with banking. Because apparently the only thing better than denying your medical claim is being able to charge you interest on the bill they wouldn't cover. It's like getting punched in the face by Mike Tyson and then having to tip Mike Tyson, giving him 20%. But here's where it gets really interesting, and by interesting, I mean infuriating. Medicare and Medicaid pay less than the actual cost of care, and the uninsured often pay little to nothing. So who makes up for the difference? It's me, the responsible working person with private insurance. It's like being the only roommate who buys toilet paper. Eventually, you start wondering why you're subsidizing everyone else's bathroom breaks. But this isn't just about simple cost shifting. Oh no, it's much more elaborate than that. Hospitals charge an average of 417% of their costs, with some charging up to 1,800%. And that's not a typo, 1,800%. It's like buying a $5 coffee that suddenly costs $90 because reasons. But the plot twist, despite these astronomical markups, many hospitals operate on razor-thin margins or even at a loss. It's like a restaurant charging $100 for a burger, but somehow still losing money on the sale. Welcome to the wonderful world of American healthcare economics, where nothing makes sense and everything is expensive. And let's talk about those working people for a moment. They're caught in a perfect storm. Their premiums go up every single year, faster than their paychecks, their deductibles are higher than their savings accounts, and their coverage gets worse every time their HR department announces exciting changes to your benefits package. It's like paying more for a gym membership that keeps removing equipment and replacing it with pictures of equipment. The solution? Some accountability. That's about as popular as suggesting a diet at a pizza party. Politicians won't touch this because telling voters they might need to pay more or receive less is basically political suicide. It's easier to kick the can down the road with future generations and let them deal with it. After all, us Gen Z and millennials love paying for things they'll never get to use. Right? And we're already experts at that thanks to Social Security. So let's break down why finding a solution is harder than explaining TikTok to your grandma. First, there's the Medicare for All crowd, suggesting we should have a system like every other developed nation. But the response is calling it socialism, which many of us Americans are just not fans of. It's like watching people protest against fire departments because public firefighting is a slippery slope to communist book clubs. And to be transparent, I'm not a fan of this, I am just poking fun at it. Then there's the free market solution gang who believe the invisible hand of the market will fix everything, because that's worked very well so far. It's like suggesting we solve traffic problems by removing all traffic lights and just letting cars figure it out by themselves. What could go wrong? And don't forget that technology will save us optimists who think AI and apps will revolutionize healthcare. Sure, because what the American healthcare system really needs is another way to automatically deny claims and send you push notifications about your unpaid bills. But here's a radical thought. What if you combine the best parts of different systems? We could keep private insurance, but regulate it like a utility. Standardize pricing so a Band-Aid doesn't cost more than a PlayStation. Make billing transparent, which is a revolutionary concept, I know. And actually enforce antitrust laws against healthcare monopolies. But suggesting this is like proposing a vegetarian option at a Texas barbecue. It may work for you, but you're not making any friends. So while we argue about the solutions, the system continues its merry dance of destruction. The average American now spends more time comparing medical bills than watching Netflix, which is really saying something. Medical debt has become America's favorite family heirloom, passed down from generation to generation like a cursed antique nobody can sell. And let's talk about the hidden costs. Doctors are spending more time doing paperwork than actually seeing patients. Nurses are burning out faster than cheap Christmas lights. Patients are rationing their insulin and medications like it's a rare vintage wine. And mental health issues from the stress of medical debt, which ironically creates more medical debt. It's like a perfect cycle of misery, like a healthcare snake eating its own tail while sending itself a bill for the procedure. So my friends, here we are in a system where hospitals charge whatever they want, like a toddler making up prices in a pretend store. Insurance companies deny whatever they want, like a magic 8-ball that only says no. Working people pay for everything because apparently that's their superpower. And nobody knows what anything costs until after they've agreed to pay for it. Everyone's unhappy, except the pharmaceutical executives buying their 3rd yacht and 5th house in Aspen. But hey, at least we have the freedom to go bankrupt from our medical bills. So remember that chest pain we started with? Turns out it was just anxiety about the American healthcare system. And unfortunately, anxiety treatment is not covered by your insurance plan. That'll be $5,000, please. Would you like to set up a payment plan with our newly acquired lending division? The interest rate is only slightly higher than the GDP of a small nation. And the best part, while you're reading this, somewhere in America, a hospital is charging $100 for an aspirin, an insurance company is finding new ways to define experimental treatment, and a medical billing office is generating random numbers like a lottery machine. And somewhere, a CEO is getting a bonus larger than the combined salary of their entire nursing staff. Welcome to American healthcare, where the bills are made up and your insurance doesn't matter. But at least we can laugh about it a little bit. Laughter is the best medicine, and surprisingly, it's still free. though some insurers are working on changing that with a proposed involuntary emotional expression surcharge. So eventually, as you swipe away from this video and reach for your blood pressure medication, which is only $847 per pill with insurance, remember that change is still possible. It might not come today or come tomorrow, but eventually something has to give. Also warning, side effects of watching this may include increased blood pressure, spontaneous crying, sudden urges to move to a different country. Please consult your doctor if symptoms persist, though that consultation will probably be out of network. This warning is not covered by insurance and we billed separately at a rate of $250 per second watched. The end. Additional charges may apply for watching the ending. Premium endings available with qualified viewers with gold level coverage.